live. Madam President. Madam President.
Oh, sorry. Yes. Good morning, good afternoon, good day, and good evening, wherever you are in this part of the world. It's always such a pleasure coming into your living rooms every Sunday so we can commiserate, we can share notes, and of course, visit with one another. With this pandemic that has befallen us now going into year 2, it doesn't seem like it's letting up at all. So I'm hoping that each and every one of you that is watching us is going to enjoy this absolutely fabulous, fantastic show that we've put together today concerning COVID-19. We have some beautiful experts on our show today, and we are hoping that you can share our link. We're on Facebook and we're on YouTube as well, so that you can follow what exactly is going on in real time today regarding the COVID. For those of you who haven't watched us before, we've done a prelim to this show before, and there was an overwhelming demand and overwhelming asking to say they wanted us to repeat, even though we're not using the same doctors or the same fora, but we have experts that are here with us today, and we're hoping that you will learn something and you'll ask questions, as many questions as you can, because this is your time. Knowledge is power. If you know what you're dealing with, you know how best to receive it. Mainly the vaccine, the COVID-19 vaccine. The topic today will be discussed by these astute doctors on why some of us people of color, especially even on the continent and even here, I think I'm also a skeptic to myself, so I'm glad that I'm on this show today, but I may be convinced as to why I should take that COVID. Am I sure that I'm not being used as a guinea pig like they've done before? So those of you who have doubts like myself, please stay tuned, stay listening, ask questions. We're open for you to call in if you'd like. Send your questions on Facebook. We will be live. Ambassador Lisa is here. She will start answering your questions. If we can't answer the questions, we have our experts online today. So please stay tuned. Don't get bored. This is your life. This is for you. Right now, I'll hand over to my host, Mr. Asonglefac, and he will introduce everybody else after our chair as well has the waters too, before we actually start the show, and Ambassador also Prophetess Lisa. Is that the entire team that we have today? We don't have our CFO, right? Is she on?
She'll be joining soon. Dr. B is on her way too. So. All
right, so our CFO too, as soon as she joins, and Dr. Ogoji, the team for Africa Online Media, we will introduce them, or they'll introduce themselves to you later. But here we go. Let me not take up too much of your time talking. COVID-19 vaccines.
Why the mistrust? Good day, greetings to everybody. If you're on the continent, we say good evening, good morning, good afternoon, good night. Some people are already in bed because it's late in their part of the continent. All the same, we're out here and we're doing our best to make sure that we stay with you. Hello, all the ladies, please, you're welcome to the show. Forgive me if I'm being like that, but that's just me. I'm the only man in the yard. So don't worry, I'll keep all of you comfortable. All right, that said, February 28 is the 59th day of the year 2021, that is on the Gregorian calendar. We have 306 days until the end of this year. It is the last day of February in a normal year that this one is. You know, last year it was a leap year. It is the last day, as we said, of February, and there is a lot to do, a lot to hear, and a lot to discuss. But then, take a break, let's take a breath and do this. National Public Sleeping Day happens to be today. Oh, did you have enough sleep today? National Science Day is today. Women excel in science these days more than men. So I believe that is why they're all here today. National Tooth Fairy Day is today. What did you tell your kid about that tooth that fell off last night? Anyway, today is Rare Disease Day. What? And on this last one, as if humanity has not had enough, we have this faceless pandemic marauding around, sowing havoc, disseminating families and communities, and leaving behind pain, sorrow, and uncertainty. As we reflect on that, let us recall that on this day in 1922, Egypt gained its independence from Britain After 40 years of British rule, Great Britain had seized control of Egypt's government in 1882 over concerns for British interests, always their interests, including, of course, the Suez Canal. On this day in 1963, and as we end Black History Month, United States President at the time, John F. Kennedy, asked Congress for a civil rights law giving voting rights safeguards against racial discrimination. And on this day in 2014, Ukraine authorities, the authorities of Ukraine, accused Russia of invading their territory when the Russians deployed troops and occupied government buildings in the Crimea. Well, trouble is always being sought by some people, but we're not here to look for trouble. So good and bad memories always happen. And so on now to what we are doing about this faceless monster marauding around. One of the best brainy quotes I came across preparing myself for today's broadcast is from Jeffrey Kluger, a senior writer for Time magazine, who tells us, quote, "Vaccines save lives. Fear endangers them. It's a simple message parents need to keep hearing." Tom Frieden, the 16th director of the Centers for Disease Control and Prevention in the United States, that is, adds, quote, "Vaccines and antibiotics have made many infectious diseases a thing of the past. We've come to expect that public health and modern science can conquer all microbes, but nature is a formidable adversary," end of quote. With those two quotes in mind, we embark on today's discussion, convinced that Africans, in short, Black people the world over, will find a place in their hearts to trust vaccines and vaccinations in general, and to be spared the uncertainties of living in fear and doubting or being skeptical about what science offers through vaccines. The story of vaccines and vaccinations is centuries old, going back to a time when Buddhist monks drank snake venom to confer immunity to snake bites and smeared ton skin with cowpox to confer immunity to smallpox. Those are words from that time. That was practiced in 17th century China. However, it is not until 1796 that a man named Edward Jenner, now considered the founder of vaccinology in the West, inoculated a 13-year-old boy with vaccinia virus or cowpox, and of course, demonstrated immunity to smallpox. But we will leave all that to our panel of experts and specialists who are here today to help Africa Online Media Corporation shine the light on vaccines and vaccinations. They will further help Africa Online Media Corporation do what it does best, that is, raise awareness on a pertinent issue that causes so much fear and sleepless nights to Africans and Black people across the globe. On that note, one is tempted to quickly ask, what is the fuss all about? Why should vaccines or vaccination, for that is what it matters, why should they cause such fear and give people sleepless nights? What are vaccines in the first place? And what is vaccination all about? Again, we will defer to our panel of professionals and other experts to address those concerns. And we want to borrow from Alexandra Mina Stern and Howard Markel, who, in their work, The History of Vaccines and Immunization, Familiar Patterns, New Challenges, demonstrate that, quote, the need for secure funding mechanisms, streamlined manufacturing and safety concerns, and deep-seated public fears of inoculating agents, quote, end of quote, continue to dog international and national efforts in developing, transporting, and delivering vaccines to where they need to be, to where they needed or where they are needed the most, sorry. We also want to piggyback on what Rebecca L. Weintraub, Laura Subramanian, Ami Kalash, and Iman Ahmed, as well as Julie Rosenberg, see as, quote, leaders' reluctance to invest in evidence-based vaccine delivery strategies that generate demand, allocate and distribute vaccines, and verify coverage, end of that quote. If, as they say, Vaccines train the immune system to create antibodies that kill or weaken germs like viruses and bacteria. Then why is there a reluctance on the part of leaders and politicians to provide the needed support that we need, that are required to ensure successful development, distribution, and application of such vaccines where and when needed? Whatever leadership has done, is doing, or will do in the face of that monster we referred to earlier, let's take heart and listen to Jeffrey Kluger. Quote again, vaccines save lives. Fear endangers them. It's a simple message parents need to keep hearing. Our chair down in Houston, I believe still, will now take the microphone and introduce our guests. So we'll get this show started. Reverend Pam, over to you.
Yeah, thank you so much, Nia Song. I am glad you're a very secured man. You are not intimidated by all these beautiful, brainy women on the show. However, Dr. Joe Akamango is watching on Facebook, so I sent him a text. If you see my head moving around, I'm actually monitoring Facebook. So I let him know that you are kind of lonely, even though I don't know what time it is now in Italy. If you can zoom in and just keep you some company. And before I welcome our beloved sisters, I just want to put a disclaimer out there. We on Africa Online, we have nothing against brothers, okay? We did not design this show to be all female panel. So we're not discriminating. We're not feminists. And if you have any problems, go after Dr. Ajibade. She's the one producing this show. It has nothing to do with it. So I just want to put that disclaimer out there. But I would just like to welcome our viewers one more time. And also on behalf of Africa Online Media Corporation, I want to welcome our beautiful sisters, Dr. Ngozi Onoa, whom I just had the privilege of chatting with just about an hour ago, less than an hour ago. You guys all know what was happening with Houston, the Arctic blast. So I didn't get a chance to speak with her prior to today. And Dr. Susan Gombo, I told her that her name was making me hungry, and I'm sure I'm not the only one. Her name does that too. And also Dr. Bitazong and Dr. Adebusola Ajibade. Last month end, you know, we had a fantastic show on the COVID-19 vaccine, and a lot of viewers were disappointed that we had to end at 90 minutes. So we decided to do this a special show for 2 hours today. I know that the 2 hours will still not be enough, but those of you who have been watching us and following us for the past 5 years, you know, this show is unscripted. You know, we are very flexible and accommodative, and also the last since February of last year, every show that we have done has been connected to the pandemic. You know, we only do the health topics at the end of the month, but every single show, whether I was traveling, whether I was dating, whether I was marriage, or whatever it was, we connected it to the pandemic. But this is Black History Month. So today we want to focus on the distrust of the vaccines in our community, not just the African community, but also the Black community. There's a lot of distrust. We know most of the people that die are our people. And even with the vaccines distribution, our people still have not gotten the vaccines. There have been efforts by this new administration to take the vaccines to the people, but we have our beautiful sisters here that are going to be addressing all that. So I would like our sisters who are on the panel today to take a minute and introduce themselves, starting with Dr. Ajibade, who is the producer of this show. So please unmute yourself. You know, I know you introduced yourself last month, but we still want to hear a little bit about you. And then after you, I'm just going to go through the screen. After you introduce yourself, I'll call on Dr. Ngozi, and we'll go to Dr. Gombo and Dr. Bitazong. So just take a minute to introduce yourself, Dr. Ajibade.
Hello, everyone. Good evening, afternoon, or morning. I guess if you're in Asia, it may be morning. Very nice to see you again. I'm Adebusola Ajibade. Many of you know me as Ade. I work in medical affairs in the pharmaceutical industry, and I also have training in academia, in immunology, and also in cancer research. So I hope to be able to add maybe comments around how the clinical trials, or even about immunology, what is herd immunity and why is it important for us to, get vaccinated, not just to protect ourselves, but also protect our community. So very happy to be here again. Thank you.
Awesome, awesome. So Dr. Ngozi, if you can kindly unmute yourself. This is your first time on the show, but it's not going to be your last time. So if you can kindly take a minute to introduce yourself, my beautiful sister.
Thank you so much for inviting me to this program. I'm really honored to be part of this August panel on the COVID vaccine. So my name is Dr. Ngozi Onoha. I'm a primary care physician, board certified in internal medicine and geriatric medicine. I have a lot of training. I also have a certificate in global health. I have an MBA in healthcare management. And I'm also a health educator. I run a blog and a brand called Health for Naija. My interest is in improving health outcomes through education and also improving health literacy to reduce the health disparities and the health divide. So I'm happy to be here. Thank you very much.
Thank you so much, Dr. Ngozi. And Dr. Gombo, the mic is yours.
Yes. Good evening, everybody. Happy Sunday to everybody. My name is Susan Gumbo. I am a pharmacist. I've been practicing for 5 years in the retail sector. I also hold a bachelor's degree in pharmaceutical sciences, the manufacturing aspect of vaccines and medications. So I'm happy to join you guys, and yeah, let's get this going.
Awesome, awesome. Thank you so much, Dr. Gombo. Just for transparency purposes, I'm also a clinical pharmacist. I've been practicing for 100 years, so I'm not as young as you, but it's my pleasure to have you on the show. Dr. B. Tazon, the mic is yours.
Can you hear me?
Yes.
Okay,
Beautiful.
sorry, I was struggling to get my computer going. My husband usually helps me with that.
That's okay.
My name is Dr. B. Tadzong from Ondam, and I'm a primary care / preventive medicine physician, board certified in preventive medicine. I have a passion for preventing disease as opposed to treating. I do treat disease, but my interest is in really preventing it and preventing the negative outcomes associated with the disease process. Thank you again for this opportunity to join this conversation today. I am just excited about what all these powerful women have to bring to the table. Yes. We are waiting for the men to join.
Hallelujah.
A lot of amazing men out there.
And, all your men are AWOL.
Love for you to come in and include your voice and your ideas in this forum, because this message is not just for women, it's for men, it's for men, women, children, everybody that is looking for information and is looking for opportunities and resources to help them stay healthy. Thank you. And please excuse my voice. Let me just give you this disclaimer. I call it my COVID voice. I've had difficulty with my voice since COVID started. I think it's allergies. So sometimes my voice may break, but I'm going to keep pushing. Thank you so much.
Thank you, Dr. Tazong. Before, like I said earlier, this show is unscripted. I just want to acknowledge our Ambassador Lisa, and our CFO, Reverend Solange, is on the show. So I am going to hand over to our main anchor to throw the first question. Again, this show is unscripted. So Nia-Song, over to you.
Before we start the show, can I please do my own thing? I forgot. Ladies and gentlemen, those of you who are coming on this show for the first time, we also have a fundraiser, which we've been doing since last year. We are doing Boho 55, and we would appreciate you going to our website and also giving us a contribution and a donation. Your donation and your participation in this show allows us to stay live. Look at all those beautiful faces you're looking at right now. Look at all that expertise that you're looking at right now. Look at all this knowledge that you're going to be acquiring from them today. Without your funding, without your donation, ladies and gentlemen, it becomes a little bit difficult for us to operate. So we would really, really appreciate you going to AfricanOnlineTV.org. Thank you. Yes, sir?
Thank you very much. And we're going to dive straight into the show, but I will just go straight therefore to Dr. Ajibola to say, please, you have the priority. You will co-anchor the program. You will lead us in the first part of the discussion. So we talk about vaccines, we talk about COVID, but we have that big word, mistrust. What is going on among and between and with Black people the world over, as far as vaccines are concerned? Dr. Ajibola?
Thank you, Ajibade.
Ajibade, sorry. I got your name.
No, it's all right.
Sue him. I'm tired of him butchering people's names.
No need to sue. It's all love in here. Thank you very much.
Thank you.
No worries at all. Thank you very much. Yeah, I think the hesitancy maybe varies depending on where you are. There's probably some similarities generally, and then there are probably some regional or more cultural, regional specific mistrust. But I think in the United States, what's happening here is, you know, a lot of people are just looking back historically at some of the misdeeds and unethical research practices that have taken place in the past. And I heard there's a lady, her name is Harriet Washington. I do encourage you all to look her up. She's written a book called Medical Apartheid, and she spoke for Black History Month at Harvard Center for Bioethics. And she's written a very powerful book about the historical reasons why there's mistrust. And it's beyond Tuskegee. Tuskegee, I think, is like the main guinea pig on this issue in the United States. And she not only referenced the United States, she also talked about certain pharmaceutical practices that are taking place in Africa. And I was telling my husband the other day, I said, sometimes Black people, you know, we don't trust them. Like, we don't trust them. Sometimes we don't even know why. Or the memory is vague, but we just generally, you know, we're very suspicious. Those people. And, you know, so I think there's a general sentiment of mistrust, even unfounded at times. And then there are very definitely some real tangible historical reasons why there's mistrust. But, you know, I think for this moment and at this time, I think what we have to remember is there's a global health crisis, and we need to be focused not just on history, but the moment. And what I, you know, did mention is there are Black people who helped to develop these vaccines. There are Africans in diaspora at Yale, you know, I'm forgetting some names now, who are investigators in the clinical trials. In the United States, there's a Food and Drug Administration that has to approve. It's a regulatory agency. There are minorities working in those organizations. There are minority doctors that help to develop these vaccines. Even in the pharmaceutical industry, Pfizer, Moderna, there are minorities working there. So yes, there is historical reasons for distrust, but we also need to look at the public health emergency we're facing right now and consider that. I also do like to address the fact that the trials had about 10%, both of them, 10% Black people in the trials. So compared to, you know, some other trials that the pharmaceutical industry has done where the only 1 or 2 or 3% Black people, I think Pfizer and Moderna, you know, did their best to represent minorities. So I hope that we'll move past the hurts and mistakes of the past and focus on the present and what we need to do in the present to achieve this herd immunity. And I think we're all looking forward to retaining whatever normal looks like. So we need to focus on that and move forward. Thank you.
As our chair said, thank you very much. As our chair said, this is an unscripted show, and we want you to weigh in when you feel like weighing in. But I want to bring up this question, which I think was on my mind the last time we discussed vaccines. Are vaccines the silver bullet in curing or in preventing these diseases and these viruses that come around almost every other time we talk about life? Anybody can go, please.
I think vaccines are more towards preventing the disease other than curing it. And the more people we vaccinate, the better we achieve herd immunity. And for that to happen, almost everybody has to be vaccinated. So vaccines is not to cure, but it's to prevent.
Thank you very much. I've now been strengthened by the coming in of my cowboy colleague, a friend, rather brother of the show, Dr. Ogoji. Dr. Ogoji, you are welcome. We're talking about vaccines and the mistrust among the Black populations of the world. So we were just trying to introduce the show. Are vaccines a silver bullet? Maybe you have an opinion on that before we take the round again.
Well, a bullet is something that kills a disease. So vaccine will not kill the disease. Yes. There is no cure for viruses. Viruses come, and most viruses are self-limiting. However, with vaccines, people can develop immunity to the disease, and then they can fight the disease themselves. Vaccination has been around for a long time. It has been shown to be very effective for so many viral conditions that have killed a lot of people in the world. So it's not a bullet, but it will help build immunity and make people get less sicker, less severe disease, and then protect the community.
Dr. Noah?
Okay, thank you so much. That's a great question. So in terms of vaccine being the silver bullet, you have to look at the history of vaccine and how it came to be. Disease, you can prevent disease through many ways. You can prevent disease through risk reduction and general lifestyle changes, medications. Vaccines have a very important role. So when you look at the way vaccines have been developed through the years, you can see with the COVID pandemic, we had no choice but to accelerate and change the way vaccines were being made. Historically, we've had different types of vaccines against viruses and bacteria. We have pneumovax, we have tetanus vaccines, and those vaccines have been around for a very long time with established efficacy. We all know that if you step on a nail and you haven't had a shot, tetanus shots, in 5 years, you will go and get a tetanus shot. I think with the COVID vaccine, some of the distrust stems from the rapidity of let's say, the speed at which these vaccines just popped up. Traditionally, vaccines take a long time to make, but because this is a terrible disease, I don't think we've had anything like this. In 1918 was the Spanish flu that killed a lot of people. And we're seeing something similar to what happened in 1918. The difference between 1918 and 2020, when the COVID pandemic was announced, is that we have technology. For instance, when we look at the mRNA vaccine, the Pfizer and the Moderna, I think there are 2 more in the pipeline. The mRNA technology has been studied for about 2 decades, and it actually started here in Philadelphia, where I am, at the University of Pennsylvania. That's where they started the technology for mRNA, which is a new method of delivering vaccines. However, when the pandemic was announced, because of the seriousness of this disease, we know that this COVID is not just it's a simple type of disease. It's a multi-systemic disease that doesn't spare any organ in the body. So because of the seriousness of the disease, scientists made efforts to accelerate the production. And in fact, the FDA accommodated sort of a multi-step approach to making this vaccine. Steps that were going on simultaneously, maybe steps that would have taken 10 years, they made those steps happen all at once. And the vaccines were tested and have been proven to be safe. So I hope that answers some of your question. If not, I can go back and talk some more, but I'll stop at this point and let someone else jump in.
We'll get back to you. Thank you very much. Dr. Bitas, it's not because you came late, but because we are going around the table. So please, after A should have been B, but don't worry. Be happy as always. I know you. So please take it from here.
I mean, it's just impressive to listen to all the things that are being said about the whole vaccine and the disease process. Let me just put a little bit of perspective too on some of what Dr. Ajibade said and Dr. Onuha too. She talked about the resistance to vaccines in the US. Let's also pull it just amongst the Black population and also with even in Africa, because it's the same kind of problem. So when this started, there was a family in New Orleans, in Louisiana, where the man died, his brother, I think 4 men in that family died from COVID. And so the wife came and talked about it. And she said, you know, in Louisiana, and I think if you know the demographics of Louisiana, there's a good number of Black people there too. Those are some of the places where they used to bring in slaves and so on. And she said Black people, healthcare is almost like witchcraft to them. They are very suspicious of everything that has to do with healthcare. Again, because of the history. It's not just the testing. It's not just all the unethical things that they did to our people. It's because that problem continues. You cannot come to the equity table with dirty hands. America has never candidly addressed this problem. And the way I think about it, and let me put it out this way so that the average person will get what I'm saying. It's almost like a woman and a man who are married and they love each other. And then let's say the man cheats on the wife, okay? And she finds out and he comes back and he says he's very sorry. He's going to try to fix it. But you know, moving forward, there's a breach in confidence. And that man is going to have to, the bar has been raised for him to prove himself. And so if the man doesn't go above and beyond the call of duty, it's going to be hard for him to fix it. And even in the process, he has to bear with a suspicious woman. So, and this is not just a man-woman thing. I'm just giving a very classic example. So it's almost like a marriage situation where Black people have been so assaulted in this country that the bar to get Black people on board is much higher than the average person. So everything for them is something that they suspect. One of the reasons why this family lost so many people is because they didn't seek care early. They don't trust the hospitals. They don't trust doctors. They don't trust a lot of things that have to do with healthcare. So by the time somebody decides to go to the hospital, they are just about to die. And the healthcare disparities, the discrimination, the mistreatment of Black people continues until this day. There are so many things. Black women are more likely to die when they're having babies. Black babies, this is so funny, and I tell a lot of my white colleagues, I say Black babies are 3 times more likely to die if they're taken care of by a white doctor as opposed to a Black doctor. So this problem doesn't end with vaccination. It's a systemic problem. And unfortunately, there's not enough goodwill to address it and to say we want to fix this problem and we want to rebuild the trust that should exist between us as human beings. So I think that I don't know how that's going to end up, but I also think that we also need to commit to having more Black people in healthcare, because people tend to fight more for their own type of people. I hate to say that, but it is the truth. And that's one of the reasons why we talked about the Black babies and the Black women and so on. And I find a lot of my Black patients who don't trust anybody, when I talk to them and I explain stuff to them, they become open to taking stuff. They become open. I showed myself, I took it myself. And I said, you know, I know a lot of bad things have happened, but we need to find a way to move forward. And I said, don't deprive yourself of the ability to get ahead of this disease, you know. And so I think the commitment is going to have to be systemic, where you talk about the socio-ecological system of doing things, where you don't just fix one thing, you don't just make the vaccines accessible, you also help the people, you educate them, you allow more of their type of people to talk to them. A lot of communities, if you don't allow people to talk to their type of people, you're never going to make a breakthrough. And then when you go to Africa, it's not only, we didn't have the things that they did here, but they've also done a lot of unpleasant things in Africa. So Black and brown people in general distrust anything system about the government. Doesn't matter if it's healthcare, vaccines, and so on. And so we need more voices from Black and brown people talking to Black and brown people about getting healthcare, and also putting out pictures and putting out information and telling them this is what we did. I got the vaccine. And I feel like, you know, everybody may not be able to get it, but most people that are able to get it should get it. And when they hear from our type, they understand. And then the other thing we are forgetting about Africa is that Africa has always been treated like the stepchild. So yes, the vaccine is good, but I always question, what kind of vaccine are they going to take to us? Are they going to take the lowest quality, the bottom of the dregs to us? Because they've done that many times before. There was a study, there was one of my colleagues, an infectious diseases doctor, was talking about something they did in Nigeria, where they came and tested an antibiotic, and they didn't tell people, they didn't do informed consent. They didn't tell the parents that this is what could go wrong. and most of the children that got that medication died. So there is no way you are going to go into this community and bring something new to them. They will not accept it. They will not believe you. And that is something that cannot be fixed from outside. It has to be fixed from the inside. And then we have also one of these huge companies that was based in India. They were producing a lot of medications and they were doing a lot of fraudulent stuff. And when they asked the guy, he had been hired by a lot of these charity companies to produce HIV medications to send to Africa. And they didn't care about the quality. So technically they're paying the money to send antiretrovirals to African countries, and they did not care about the quality of those medications. And when one of the people there asked this man, said, don't you care that you're actually not treating people? He said, basically, those are Africans, who cares? You know what I mean? So we have always been looked upon as subhuman, and we cannot fix how other people feel, but we can fix our circumstances. And that's why I said, complaining and complaining is not going to help us. How do we jump in this thing? How do we start doing our own research? How do we start harnessing our own skill sets and knowledge to help our own people? Because I'm very confident that if vaccines are developed in Africa by Africans, you won't have as much resistance to the vaccines as you do with things coming from outside.
Reverend Pan.
Yes, actually, where's our president? She has a couple of questions, and I think there are two more from Facebook. So, Madam President, if you want to take those, I'll go after the president.
Sure. There's a question here from Joseph Akamangwa. What role does heat play in the fighting this COVID-19 pandemic?
Well, I can take this. We all know that flu or all viruses strive better in cold weather than hot weather. That's why during the summertime, the amount of COVID or the rate of COVID dropped significantly in the whole world. But on the other hand, we don't know what's happening because a country like Brazil has the same temperature with Africa, doesn't go below 70 degrees, has a lot of death like the US. So heat is protective, but does not stop the virus. So Brazil, when I try to look at it personally, I found that Brazil has over 15% of its population above 75. So Brazil has a population at risk. So the heat in Brazil did not protect the old people. I'm sure more people would die in Brazil if they were in the northern hemisphere, either as cold as US or other parts. But they have the old people, so it still affected them. So Africa, people say because of the heat, anti-malaria, because of immunity from other viruses. Yes, but we do not have a good amount of people at risk from this virus. Most people die in this part of the world are 75 and above. The few who die younger have had triple bypass, double bypass, cancer survivor, all those things. People with bypasses are not found anywhere in Africa. They all die from the first heart attack. We know that the average life expectancy in most African countries is 65 and below, compared to 75 and above for developed country. And if you have a heart attack in Africa, in Nigeria, for instance, you are dead. But if you're in the US, you have one bypass, two bypass, three bypass, you survive. The COVID gets you, you die. So heat is protective, but it's not absolutely protective, because if you have the population at risk, more would die, but not as much as they would die if the weather was cold.
Thank you very much, Doctor. Next question is,
something in there to what Dr. Ogaji said?
Absolutely.
Oh.
I think what he's saying is absolutely true, but I think sometimes we should be careful not to oversimplify things, because there's not just one reason for all of these problems. There are a compendium of reasons, and we need to put them on the table. One thing we need to remember is that Brazil is kind of like America during the COVID. They had a leader who was like the American leader, defiant. And he himself, I think he got COVID, and a bunch of people around him got COVID. And in fact, he exposed our leadership here to COVID too. So what we should not forget about is public health policy, because that's where the politics comes in. Public health is the key to slowing down the COVID virus. And it's the key to basically slowing down a lot of public health diseases. And when you have bad governance, not necessarily because the people are bad, but because they are misguided, and they don't enforce public health policies. Bolsonaro, that's exactly what he was doing. He was doing what our father here, Trump, was doing. And so they did not care to enforce public health policies. And so with all of that, it increases the risk significantly, because there are a lot of other countries where we have older people too, and they didn't die the way people died in these two countries. It was basically political negligence.
Can I say something also?
Yes.
Sure.
So in terms of the numbers of people who've contracted COVID in Africa, I have to say that it's not accurate because of lack of testing.
Yeah.
So I understand that recently a study was done in Nigeria where antibodies were tested, and they found a high rate of people who had COVID who had not been diagnosed. So in terms of heat, heat is not protective against COVID. So in fact, in my experience from the stories I've heard, I mean, I've had 2 classmates who died from COVID in Nigeria. So COVID is highly virulent and it spreads in spite of heat. So heat is not protective against COVID. And what we may be seeing is because there's certain criteria that put people at more risk of COVID. So that includes obesity. And you know that obesity is more prevalent in the West because of Western diets. You hardly see the man on the streets in Africa obese. So because you have some of these factors, obesity, diabetes, lung disease, and other immune suppressive conditions, because of that, it appears as though the West is at higher risk. But the developing countries are also at risk. It's just that they may not have that criteria of people. So we're not seeing as much COVID as we're seeing in the West because of the risk factors. But COVID is highly virulent. It spreads very seriously, and the heat does not reduce the spread of COVID.
Thank you.
Thank you. Any other doctors? Any other takers?
I was just going to add that we also shouldn't forget, as we think about Africa, even though there are challenges with healthcare access here, based on socioeconomic status, that it's even more magnified and more severe in African countries where access is determined by the size of a pocketbook. So there are probably also a lot of unreported deaths. So there's this myth going around in Nigeria, for example, and I don't know about other countries, that COVID is a disease of rich people because there have been a lot of prominent political leaders and elites that have died from COVID that have made the news. But of course, those people have access to the best healthcare system. So they're getting diagnosed, and subsequently when they die, they know the cause of death. But we do know that there are deaths going on every second in many African countries, and they just bury them and they probably never test. So, just going back to that lack of access, even before the test gets done at all. And it probably just gets attributed to other things, typhoid fever, malaria, and some of the more common ailments in most of those countries.
Yeah.
Dr. Ajibade,
Dr.
can I ask?
Ajibade?
Oh, okay.
No, go ahead, Dr. Ngozi.
Yes, back to piggybacking of what Dr. Ajibade is saying. There's a lot of stigma regarding COVID in Africa. To be honest with you, we've gone through a year of this COVID, and you often hear people who have symptoms. They have cough, headache, shortness of breath, and they don't seek care. Number one, they can't afford it. COVID admissions are very, very expensive. You're talking about 2 million naira per day, when that person barely makes 50,000 naira per month. So people are self-medicating, and that's the reality. And there's a lot of underdiagnosis, to be honest, because at the time the pandemic started, people were actually very scared to seek care. I can tell you that, because when you look at what happened during Ebola and the way people were managed, you can watch that movie, 93 Days.
Yeah.
And people were scared because at that time there were maybe one isolation center, and it was that same isolation center where they took care of Ebola patients. Nobody wanted to go there. So if people had cough and they had the symptoms consistent with COVID, nobody wanted to come out. So I think the numbers for Africa are actually underestimated, in my own opinion. I think a lot of people had COVID and pulled through because they were not in the high risk category. And what we're seeing maybe in some of the African elites is that they fall in the high risk category because a lot of them are older. Recently, we heard of a funeral and almost all the professors that went there had COVID and died. So you're looking at the group that is above 65, which is a high risk group. And most people have undiagnosed conditions. People are walking around with diabetes, they don't know. So you tend to see that more as people get older. Diabetes is more common. And so there are a lot of factors. We can't really pin one thing down to the numbers that we're seeing. We know that this is a very virulent infection. And it has various levels of presentation. It can present as a mild illness, which is self-limiting. Those people get better on their own. It can present with a moderate illness, which can present, people have been treated for malaria, typhoid, whereas they had COVID. And don't forget, we're also seeing false negative tests. People with COVID who get tested and the test is coming back negative. That's another issue. And then you have the very severe cases. So what we're hearing about are the severe cases, the people who end up in intensive care units. And those tend to be more of the elite because they can afford the care. It's very expensive in Africa to have COVID care in intensive care. Just the medication, the remdesivir, is costing almost 300, 400 naira per vial. And you need at least 6 to 10 days treatment. Whereas the person on the street makes 50,000 naira per month, and then you have a treatment that costs 300 to 400,000 naira. Who can afford this? So what we're seeing, it's kind of skewed because we're seeing the elite. People think it's a disease of the elite. No, it's not just a disease of the elite. It's a disease of everybody. But the issue is that you're seeing the elite in the hospitals, in intensive care, because they can afford it.
To add to this, okay, to add to this, I was in Nigeria for complete 6 weeks. Complete 6 weeks. People say there's no COVID. I mean, I wore my mask, I look strange. One fateful day, I was in my house. I didn't go anywhere. Kept my gate open. I counted 8 corpses.
Oh no. 8
people were buried there. They just passed from my house, bury us. So in Nigeria, people are dying every day. If there used to be 1 death, if there used to be 5 deaths a year in Nigeria, this year will be 5 times 3, 15. But the number one, we don't know what people don't know what's killing them. There's no documentation, and most importantly, people die. People blame witchcraft or other type of things. And luckily for us, we don't have a lot of elderly. I mean, don't tell me about the 100-year-old man in your village. How many of them are there? There are 101, there's 200. I mean, how many of them are there? I can count in my family, for instance, with a size of about minimum of 800,000 people who got your family, about least 800,000 in number. My dad is only 75. He's the 4th oldest in the family of about 800,000 people. If you go to a population of 800,000 in America, there will be at least 100,000 people above 65. So that tells you that if COVID hits my family, you only have 10 people to take away, not 100,000 compared to other parts of the world. So it's there. People are not being tested. It's just that we are very low risk population with better immune system, and that we survive it. And people say there's no COVID.
Thank you,
Reverend
Dr.
Pam, I think you have a question.
No, but let's see if Reverend Solange or Ambassador, where's Ambassador Lisa? Did we just lose her? If they have a question, I'll weigh in after. And then we have a guest with Galaxy A10, please. If you can just put your name on the chat box so we can properly acknowledge you. But I'm sorry?
Asonglefac knows my name. I'm Eric.
Okay, you're Eric.
Yeah.
You're welcome.
Oh, that's okay. I didn't know because you're wearing the mask. So
yes, I'm ready.
it's Eric
I'm
Anoma. It's Eric Anoma.
Okay, Eric, could you, welcome to the show. Do you have a question for our doctors? I'm going to rename you.
Yeah. I want to thank Dr. B. Tasson and the other panelists for their contribution. I'm so much impressed. And Africa as a whole, we need much work. Though we are going through a transition where people are beginning to understand that healthcare is a predominant aspect of the community, but there are a lot of factors because some people still believe in their traditional way. And at the end of the day, even when sensitization is done, the government need to take it up as a responsibility to be able to merge with some of those traditional doctors into the communities, educate them on the modern way of traditional medicine, and as well as collaborate with the local authorities and the communities too. Because you don't just get into the community and you say, oh, tomorrow you people are going to gather here for vaccination. And a lot of patients, people will actually ask some of those traditional doctors that, oh, is that place good for us to go there? The people act as a source of income to the traditional doctor. They will definitely say, no, don't go there. Don't go there. Why are you going there? Those people are coming to kill you. Didn't you hear how people died in Brazil? Didn't you hear how people died in India? Those vaccines are coming from those countries. They are not coming to kill us. Politically, we look at the situations in some countries like Cameroon, we look at Nigeria, we look at Cote d'Ivoire, Ghana, that has received the vaccine. What has the government done to be able to improve the situation in the communities? You still see government officials organize forums, organize activities, and they go there, some of them don't wear masks. What do you expect? The local person that is down there watching at the TV station, going to social media, looking at those government officials. What is that local person? Because we know that in African context, you know that majority of people have not been sensitized. Some of them have not gone to school. They just believe in their local way of doing things. Now, what is the government? They look up to the government. Those people they are looking up to, those people are behaving the same like them. What do you expect them to do? They will definitely stay away from when these things are coming up. But forums like this and the work of the diaspora now is beginning to educate them, because I am telling my family, please, you need to take the vaccine, but wait, I still have the fear. I told them last week, you need to take the vaccine. I took my two doses of the vaccine. The first dose, I was fine. The second dose, I had a bit of fever for 2 days, but after that, I started my work and I'm okay. But now, who brings in the vaccine? Dr. Peterson and the other doctors are not there to do a research on that. But the government have people in this research sector on the ministry for that. What are those people doing? Those people need to go through studies on those vaccines. When the vaccines come in, they go in, they do a research on the vaccines. They are able to justify and then prove that these vaccines, okay, are safe for their population. But they bring in the vaccine, they just carry the vaccines along the way without also working with the vaccines in their lab. Like Dr. Peterson said, we need to improve our own way of African medicine. We have our own locally made herbs. What are those doctors that the government have employed doing? They need to do a research on those herbs and see which one is working. Now people are sick of COVID. What do? They diagnose and they say, oh, you have malaria. Malaria is actually endemic, and majority of the people, they have the parasite that is lodging in their system. Each time you go for the test, you definitely come out positive. So what, at the end of the day, they say, oh, you have typhoid fever and malaria. That's the only thing the local population know, and they collect money from them, they treat them. At the end of the day, because you have a strong immune system that can be able to combat that COVID virus, you get well. And they say, oh, we are treating you of malaria, we have treated you of malaria, you are fine now. But you are carrying the virus in you and you keep on spreading it. You move from within the population, you don't wear a mask, you move within the population. So I think we have a lot to do. I thank you people very much for the sensitization, for the education. I'm so much impressed. Thank you very much.
Thank you so much, Eric. Thank you so much, Eric. Well, don't go away. Just stay with us. Ambassador Lisa, I think Reverend Pam was looking for you, but it's kind of disappeared for a while, but you're back. I think you have an opinion on all what we've been saying. You know Africa quite much, and you know what we're talking about on this topic.
Yes, good morning, good evening, everyone. Thank you so much for all of you coming in advance. I don't have anything to say. I just want to listen. I'm having some not responding. That's why I disappeared. My computer just kind of just shut down. So I'm trying to work to get it to back.
Thank you for posting some questions on the chat room. That's good. That's good. Reverend Solange, before we go around again. Unmute, unmute.
Reverend Solange, can you unmute yourself, please?
Yeah, she
done
just
that. Yeah, thank you to all the medical experts that we have today on the line. Each day when we listen to everything about COVID, we learn something, because right now it looks as if most people are still really learning, even the health professionals, because like a couple of weeks ago, was it last month? They announced that there was a new strain of this virus coming from Europe. And people were scared. They said some of it came, they found some in Chicago and all that. But this is really a learning process for a lot of us. And as for the vaccine, we've had really very not too good experience as Black people when vaccines gone. The medical experts have said it all. But from my personal point of view, this may sound a bit off, but I do not want to take that vaccine, because I have a cousin that took this vaccine. And a couple of days later, she got COVID. She was so sick for 3 weeks, she couldn't go to work, but she had just taken the vaccine. So from my personal experience, so this is a question to the medical experts on the panel. What can you say to someone like me that is not like, I've lived in this country for such a long time. I lived in Europe. I've been to all the continents of this earth, traveling. But for some reason, I just don't want to take this vaccine. So,
Can I?
Yeah, go ahead, Dr. Ngozi, and then Dr. B.
Okay. I think Dr. B was first.
All right, Dr. B.
Okay.
So, Reverend Solange, you know, there are many people that have experienced what your cousin experienced. It is not because of the failure of the vaccine. So, the infection by COVID is a disease process, and we find that it may take patients up to 2 weeks to have symptoms. Same thing with the vaccine. The vaccine is a process. You know, it's almost like you're going through training, you're trying to build some muscle. You don't build a muscle in one day. It's a process. You have to keep working out, and, you know, slowly you build that muscle. And with the vaccine, they're finding that after about at least 2 weeks, you're beginning to build up antibodies that are ready to fight the virus. But the thing is that some people have already been exposed to the virus before they take the vaccine, and they don't even know it. And there are a lot of people who are infected and don't know it. In fact, they say about 50% of people that are infected don't know it. So a lot of people have already been infected before they take the vaccine, and they are not aware. And so they take the vaccine, and the vaccine is trying to build up your immunity, but the disease is also going on. And so you may take it a few days later, you get the virus, and they'll think it's from the vaccine is not capable of giving you the disease. All it does is stimulate the immune system. It doesn't have the entire virus that is capable of making you sick from the virus. It just has a spike protein that stimulates your immune system and gets it to recognize the real virus when the virus hits you. So your cousin is, maybe we can say maybe they're lucky, because maybe if they didn't get the vaccine, they would have been much sicker, or they may not even have made it. For all the people that say, well, I got the vaccine and I got COVID, it's not because of the vaccine, or it's not because the vaccine failed. It's because those things must have happened kind of close to each other, and you had not yet built enough immunity to help you. But also, even with the vaccine, you can still get COVID. The whole thing about the vaccine is that your body is better equipped to fight the virus. So you may not get as sick, or you may not die from it as much as people who have not taken the vaccine. So that's my feedback to you. And I hope that more people would look at this and realize that it's not a failure. It's a process, and the process has to be completed for you to get the full results. And so if it's not complete, sometimes things go wrong, and it looks like the process is failing. It's not a failure of the process.
Awesome.
Thank you, Dr.
Excellent.
B. Reverend Pam, I think we're at the top of the hour.
I know
Dr. Noah,
Let's Dr. Ngozi go ahead. I will go after
Okay.
her.
Okay.
Okay, Dr. B, you put it so beautifully. She hit the nail on the head. You know, I got my vaccine. I got the Pfizer vaccine. I got it on December. The first dose, I got it on the 21st of December. I'm sharing my own personal experience. I was a little bit anxious going there. I'll be honest with you. I was a little bit anxious, but as soon as they invited me, it was not mandated. Because this is such a terrible disease, it can affect from head to toe. People are having brain problems, heart problems. The virus attacks the lungs. It goes for the lungs. It causes all this sticky glue type of material in the lungs that leads to secondary infections. It can attack kidneys. People have gone on dialysis. It can cause blood clots that can travel to the lungs. Even upon discharge home, people have dropped down dead because of blood clots or inflammation of the heart. So when I see the problems this disease is causing, it was a no-brainer for me. I was so happy to get this vaccine. So the first dose, I'll be honest, I was a bit scared because I got the mRNA vaccine and there are no long-term studies to show any effect. This is sort of a brand new vaccine type of technology. And as of yesterday, the FDA in America just approved Johnson & Johnson, which works in a different way. It uses a viral protein and it doesn't need that refrigeration as the Pfizer and Moderna. So it's a bit better in terms of supply chain and sending that to Africa because it can stay in the fridge, I believe, for 3 months, as opposed to the Pfizer vaccine, it can only stay for 5 days in the fridge. So the first vaccine, I'll just tell you my own experience. Maybe it will persuade you to get yours. When I look at the complications of COVID-19, the disease, I don't want it because even those people who recover, they have what they call long COVID. They're still coughing. They still don't feel good. And they have brain fog and then all these other things that we don't know what is going on in the body because the body trying to fight COVID produces all these hormones, interleukins and things, what they call a cytokine storm, but it cannot differentiate what is COVID and what is normal organ. So it attacks everything at once. You see, it's like you have a mouse in your house and then you just put a nuclear bomb to try to catch the mouse, you blow up your whole house. And that's what COVID does in the body. You know, once the body sees COVID, the body now produces this ammunition. It doesn't separate this is COVID or this is normal kidney or normal heart or normal lungs. It just attacks everything at once. And that is what is killing people. Those people have that robust reaction and it is unpredictable. Nobody knows who will get that robust reaction or not. So I decided I'm going for the vaccine because when you have to weigh the risks and benefits, and I'm in the front line testing people with COVID, even before they announced the pandemic, before they announced you should wear masks, I recall seeing people that were so mystified, we cannot smell. But at that time, we didn't know about coronavirus. And we're seeing patients in the office, they cannot smell. Imagine. And sometimes we see people who they have cough and cold. They will not even tell you they have cough and cold, or I'm sorry, not cough and cold. They won't tell you they have cough and headache. And then you test them and they have COVID. So I felt a bit exposed and I felt I'm at high risk. And when you look at what happened in the UK, when you look at what happened in Nigeria, healthcare professionals are disproportionately affected. So if you find yourself in a high risk group, you have to weigh the risk versus benefits. Of course, the vaccines are not mandatory. You know, they're hoping, the governments are hoping that everybody will get it so that once 70% of the population has been vaccinated, this is called herd immunity. It means that the virus will not spread from person to person and the pandemic will end there. But they're not mandating it. You know, they're not mandating it. However, you have to look at your own individual risk factors and then decide what your exposure risk is. I personally don't like staying at home. I like to go out. So for me, getting this COVID vaccine is freedom. I'm not going to be sitting in the house. I'm not. So I want to just tell you my experience quickly. I'm sorry, I'm talking too much, but
No.
the first vaccine, I would tell you I was anxious. I really was. You know, but what gave me reassurance, as I was going to get my vaccine, I saw one of my colleagues coming out of the vaccine hall on the street, and she was almost dancing, and I waved. I said hi. She said, "Oh, I just got my vaccine." So I thought, oh wow, she's so happy. So it gave me hope. So I went, I got my vaccine. It was a very good experience. I didn't feel any pain, nothing. Later on, my arm hurt. I took some paracetamol, Tylenol, and I was fine. Now, the second vaccine, which was 3 weeks later, the first vaccine is like almost like a test dose. It's very mild. You won't get a lot of symptoms, maybe just sore arm, and that's pretty much it. But the second vaccine dose, that's the real vaccine, that's the booster dose. That's the one you're going to feel. And typically this happens about 24 hours after the vaccine. That's when you know it is really working, because you're going to feel, there are 4 symptoms typically. You're going to have the sore arm, you're going to feel tired, your muscles are going to ache, and you're going to have fever. But that clears up. So I experienced that with the second vaccine. And in fact, I was happy because then I knew that, oh, the vaccine is working. Then you take paracetamol, Tylenol, rest, go to bed early, drink fluids. Now, some people who've had COVID, that first vaccine, they have more of a reaction. Because even if you've had COVID, you can still get the vaccine. You should still get the vaccine, because if you've had COVID, your antibodies are not strong enough to protect you against a second attack of COVID. And like Dr. B said, your cousin more than likely already had been exposed to COVID before she went for her vaccine. And then the vaccine, the first dose, it really takes about 2 weeks before it kicks in. And the first dose only protects up to 61% for the first dose. Then when you get the second dose, that's for the Pfizer Moderna, when you get the second dose, it protects you up to 95% by the second week. So it does take time, because your body, the way the vaccine works is that it causes your cells to produce a spike protein, so that if it sees COVID, it will attack it. And this process takes a little while. It's not an overnight process. So the decision to take the vaccine is actually it's an individual decision, one that you can discuss with your healthcare provider and say, listen, what do you think? Do I have risk factors? Do you think this vaccine is something I should get? And I think with those who are not so comfortable with getting the mRNA vaccines, right now we have 2 of them approved in the United States. There are options. So for instance, COVAX, which is a group that was formed by WHO and sponsored by developing nations. America is one of them. They contributed money, about 7 countries or so in the West have contributed money to buy vaccines for Africa. And they just delivered to Ghana. I believe they delivered AstraZeneca. Yesterday, Johnson & Johnson were just approved in the United States. So I think this week now, they're going to start giving it out. So those people who have, and the Johnson & Johnson is only 1 dose, and it just can be put in normal fridge. So the supply chain issue is also very important in getting these vaccines to Africa. And I want to respond to what Eric was saying in terms of the fact that the vaccine has not been studied in Africans. This is true. It has not been studied in Africans in Africa, but Africans in the United States and elsewhere, they've been part of these vaccine trials. And I don't think we have the luxury of studying the vaccines, because this is a pandemic, global pandemic. We've been shut down now, with getting to 1 year. It's not normal. You know, everybody is affected, mental health, people are going cuckoo or loco, and we have to open. Economies are down, and even schools. So we don't have the luxury at this point to test vaccines in Africa. We don't have infrastructure. We don't have electricity. We don't have water. So we need to be a bit realistic. This is not the time to be testing vaccines in Africa, especially with this sort of pandemic. This is an emergency. We're facing an emergency. So the only thing we can do is trust that Johnson & Johnson is giving us the right thing, which they are, because they just got approved. And so I know the African Union has purchased vaccines as well. I think they purchased Sputnik, which is going to arrive in May, and also the African CDC. So a lot of things are happening. I'm very optimistic that by the end of the year, and this is just my own analysis, that by the end of the year, majority of people in Africa would have had this vaccine, and we will achieve herd immunity, and we'll reopen up the world.
Okay.
Thank you, Dr.
Thank you.
Ngozi. Thank you so much. Yes, I am actually going to put out some questions that will be responded to after the announcement. After the question, Madam President, you can take 30 seconds and do your thing, and then I will announce the next topic. But for our panelists, Dr. Gombo, Dr. Ngozi, Dr. B, Dr. Ajibade, I want you guys to think about these questions while we are making these announcements. One, the role of false news, the press media, anybody now with phone gadgets, it's a reporter. So there's a lot of false news out there, not just for our people on the continent, even our people here. Two, when this thing came out, there were predictions that it will wipe out Africa. But we all know that's not been the case. I was talking to our administrator, is not on, but she said, even though testing is a problem, they know how to track deaths by this COVID. They learned from Ebola. So even though documentation has been an issue, there have not been that many deaths as were predicted. So what happened? Three, I want us to address our brothers and sisters here in the diaspora, especially in the United States, the African-American community. They have access to the information just like the other community, but there's still distrust. So why? So these three questions I want our four panelists to address after the announcement. Madam President, 30 seconds to say your thing is a good thing. Dr. Ngozi touched on this water issue and electricity. So Madam President, after you announce the topics, and then we'll hear from our panelists.
Yes, thank you so very much to the doctors on the panel. This is really beautiful. And I also have two questions I want to add to what our chairman has just announced after the little commercial. This is for those of you who are watching us for the first time, and for our return viewers. We depend on your donations to continue running this program. This is your program. You can call us any day, anytime on Sunday when we're live and be a part of this. Your contribution as well to the discussion is very much welcome. Please visit our website at www.africaonlinetv, as in T for Tom, V for Victor.org, africaonlinetv.org. We have quite a selection of payment handles that you can give your contribution to. Here's one theory, $1 a day. If you give Africa Online TV, if you donate to africaonlinetv.org, $1 a day, guess what? By the end of the year, you'd have given us $265. It won't feel it. You won't feel it because it's just $1 a day. So with that being said, I hope you will support us. Two questions to the panelists. If I get the vaccine today, does that preclude me from getting the virus? If I had to die today and I died from COVID, does that mean COVID dies, or does COVID still live? Those are the two questions from me. Thank you, Madam Chair.
All right, thank you, Madam President. And we're gonna make a couple of announcements. Before I make that announcement, because it's important, we're trying to get our people here to trust these vaccines. That's what we're trying to get our people to do. And there is a video that I want to share. There's a video that I want to share. Hopefully it would, or it looks like I can't even open the video. I shared it last month, and when we were having this same show. Okay, the video is loading. I'm hoping that when our people see this, they are going to be more prone to taking this vaccine. Well, while the video is consider the fortune. Okay, hold on a second. Let me pause this. Were you guys able to hear?
Yeah, we were.
Yes.
Okay, hold on a second. I'm going to share this video to encourage our people about this vaccine's mistrust. Hopefully it would help, and let me share the screen for a minute here. Was the audio okay?
Yes, it was. You can put it a little bit louder.
Okay, hold on.
In effect, invented vaccination, introduced vaccination to America in 1721. That has to be the biggest fortune in the history of medicine, right? The pharmaceutical industry has produced many gigantic fortunes in this country, notably the fortune created by Robert Wood Johnson and his brothers in 1885 when they started the Johnson & Johnson Company, which has produced many products that have saved lives and led to the creation of the Robert Wood Johnson Foundation, which has done many good deeds. And that fortune has provided for generation upon generation of some members of the class that used to be known as the idle rich. The person who introduced immunizations in America was born into a caste that was not allowed to profit from his wisdom, from his genius, or even from his labor. He was a slave owned by a minister in Boston, a slave who saved lives in Boston during the smallpox epidemic of 1721 when he described a procedure that he had undergone in Africa before his life was stolen from him on a slave ship. Pulitzer Prize winner Isabel Wilkerson tells this story in her new book, Caste, The Origins of Our Discontents. Quote, people in West Africa had discovered that they could fend off contagions by inoculating themselves with a specimen of fluid from an infected person. That is the knowledge that slave brought to Boston in 1721, where he saved dozens of lives because of one doctor who decided to try that method that the slave described. 30 years later, vaccinations based on that method, introduced by a slave, became the standard practice in Massachusetts and eventually the rest of the country. There is no charitable foundation named for that slave. His descendants were not born into lives where work was optional. The life-saving gift he gave us did not even earn him his freedom.
Okay, did you guys all hear that?
Yep.
Okay, I wanted to play that because that is so profound. I hope one of us here have not done any research. Like I said, show is scripted, so I don't do any research before this show. But hopefully this will encourage our people, both on the continent and the diaspora, to know that the vaccines actually started with our people. So I'm not sure which country in West Africa this was being practiced in, but I am sure if we do some research, we'll be able to trace it and track it. So hopefully that will help our people. But we really need to address this, not just with our Africans on the continent, but also our people in the diaspora, especially here in the United States. So next week, we are going to be talking, starting tomorrow, we're going to be discussing prejudice, discrimination, and stereotype. That will be our topic for next week. We usually discuss these topics during the week in our chat room before the show on Sunday. So the show on Sunday is the finale of the topics. Again, we're going to be talking about discrimination, prejudice, and stereotype, especially as far as our people are concerned. So Ambassador Lisa, before you attack me, the anthem will be played at the end of this show because we have a lot to talk about. So I am going to hand over to Dr. B and then Dr. Gombo and Dr. Ngozi and Dr. Adebusola about the 3 questions, where there were 5 questions. I posed 3, our president posed 2. So please take a turn. You can choose whichever one you want to address, and then after that, we'll go back to our main host. Dr. B.
I brought up something during the chat and I really wanted to discuss it here because I think it's part of what we're experiencing with the fake news and so on. But it's not just the fake news, it's the lack of information, lack of knowledge. They call it the Dunning-Kruger effect. And basically, people are not aware of their ignorance until they make an effort to become aware. And it's not one person, it's a human condition. And so all of us humans have to stay, I hate to use this word, but all of us have to stay woke. We have to stay vigilant that we don't fall victim to Dunning-Kruger. So the whole Dunning-Kruger thing is that when your knowledge base is small, you have a lot of confidence. You think you know everything, you know, but once you realize that there's so much more out there, as you start growing your knowledge base, you realize there's so much more that you don't know. You become, your confidence level drops. And then as you learn more and become more informed, your confidence level rises, but it never gets back to that arrogant level that it was when you were ignorant. Because now you realize, you know what, even though I've learned a lot, there's still a whole lot that I know nothing about. And that really always keeps you confident but humble. Not that kind of arrogance where you think you know everything. Because a lot of times we fight with our patients. They think they know more medicine than we do. And I'm just thinking, we were trained for years in this thing. It doesn't mean we're better than you as human beings. It just means that we've been trained better. I cannot come, I always tell my patients, I ask them, what do you do for a living? Somebody tell me they're an electrician. I said, listen, I know nothing about electricity. I mean, I know basic stuff that they taught us in school, but I cannot mess with anything electrical. Can you imagine if I, as a doctor, came and was arguing with you about how to set up your electrical wiring? That would be an insult. And so it's basically leveling the playing ground for everybody to say, listen, we all have a propensity to be misinformed. And the more misinformed we are, the more arrogant we are because we think we know too much. But take time to educate yourself. Seek forums where you can learn, read. And when you read, be objective. When somebody says something to me, it's funny, in my house, right? When I read something, I'll go tell my husband, I say, did you hear about this? And he starts laughing. The first thing he does, he gets online and he starts doing research. So he trusts me, but you know what? We always say trust but verify. So when somebody tells me something, I say, where did you get that from? How did that? So I go and I want to go read it, and then I want to do some more research because I need to make sure that it is true. Because more and more people are telling lies. It's becoming a culturally acceptable thing for you to just lie unrepentantly. So they're going now to the next level where they call deep fake, where literally somebody can make it look like I said something that I didn't say, or I'm the one who put out something that I didn't put out. So it's becoming so intense that we need to be more careful. There's no longer an excuse for you not to be wise, not to educate yourself, and not to be aware. If you're not aware, you're going to fall victim to this thing. And the one thing that I just felt like God kind of clarified for me with truth, because this past year and a half, one thing I've really been trying to dig into is truth and grace and so on. Is the Bible says that you shall know the truth and the truth shall set you free. Freedom is tied to truth. Whenever somebody lies to you, it means they want to keep you in bondage. Because the truth means that you become aware of the reality of the situation, and then you can act accordingly. If you're not aware, your behavior is always subpar. So if people are not aware of the COVID situation, they start behaving less than they should, or they start behaving in ways that are not productive or protective of them. So please, we should, our community, both here and out there, when people tell us stuff, it doesn't matter how much you love them. I believe in authenticity. The only way you remain relevant is to be authentic. And I always compare it to this salt thing that the Bible says that you're the salt of the earth, you're the light of the earth and the salt of the world. And it says, if salt loses its saltiness, the saltiness of salt is the essence of the salt. If it loses its saltiness, it no longer has value. It's going to be thrown out and trampled upon. And so if you want to stay relevant and you want your opinion and your ideas to be respected, you need to always present the truth. Once people realize you're lying, they no longer trust you. And whenever they have an opportunity, they will discount what you say. If people follow lies, it's for a specific reason. Either they're too stupid to acknowledge it's a lie, or they have things that they're gaining from the lies that are being told. And I'll give you a classic example here. We've had a lot of people tell lies about COVID. COVID is not real, it doesn't exist. I've had patients who walk in and told me the exact lies that we told. It's going to disappear tomorrow. It's going to disappear right after the election. It's going to disappear at so and so time. And I said, are you kidding me? The patient said, no, I'm serious. I said, do you really believe that the virus could just disappear? I said, short of a miracle, that doesn't happen. But the patient is very confident because that's what they're carrying around. And in so doing, the patient doesn't plan or prepare for what's coming down the road, and that puts them at a greater risk of becoming a victim to that situation. But the thing is, I always say, by their fruits you shall know them. Don't listen to what people say, watch what they do. If I came in and I brought an apple tree and I planted it and I told everybody it was an orange tree, but the tree starts bearing fruit and it's an apple and it's apple fruit, that is not an orange tree. It doesn't matter what I say to you, it is an apple tree. So watch what people do. A lot of these people who are telling lies about COVID, whenever they have an opportunity to get a vaccine, they get it. In fact, we have 2 senators in this country who were the first, they jumped the line to get the vaccine, even though they were the big people pushing that COVID was fake. So watch those people. A lot of wealthy people who go around saying that there's nothing going on because it's benefiting them financially. Whenever they have an opportunity, I don't know if everybody has read about this, a lot of medications of vaccines that were directed to the poorer communities, these people are stealing those slots and they're going and taking the vaccines. What does that tell you? It's pretty important and they know it's useful. So don't listen to what they're saying. All they're doing is trying to distract you. Watch what they're doing. I don't listen to people as much as I watch what they do. If you're telling me that this thing is fake, but you're taking all the precautions, then in my mind, you are lying to me. So you guys out there, please pay attention to what people are doing. Look at how, where they say, put your money where your mouth is. That's what it said, right? So if somebody says one thing, but they're putting their money over there, you should know that that is the truth. Don't listen to what they're saying. There's a lot of lies that are going to be told, and they will continue to tell them. A lot of people are making money off of lies being told. So don't bank your health and your well-being on somebody's ability to make money. Bank it on doing the right thing, being truthful, and surviving. Thank you.
Thank you, Dr. Ngozi. And then after Dr. Ngozi, I posted it there. After Dr. Ngozi, it's Dr. Gombo, Dr. Ajibade, and then Dr. Ogoji.
All right, mine is going to be very, very brief. I work in retail pharmacy, and I'm actually part of the people giving the vaccines. Of all the people that I've vaccinated, most of them are like white and they're older. And so far we've vaccinated like about 400, like we vaccinated like 400 in a day. And out of those 400, like only 3 Black people showed up. So it raises the question, like, why are they not coming in? Some people have heard that since the Moderna is their first vaccine to be on the market, they don't really trust it because, you know, they haven't really produced anything in the past. So that's like one reason they don't want to come in, because they don't know how they're going to react. And then the second reason why is like because the vaccine is being done in phases, and you kind of have to have like an appointment to come in. Some people don't have computers or don't even have email addresses and the internet and stuff like that. So a lot of people cannot afford that opportunity to schedule the appointments to come in and get the vaccine. And then the third reason I've heard is who is funding these vaccine programs, you know, like Bill Gates, and they question the idea behind it. Just a few weeks ago, I listened to a documentary saying that, you know, Bill Gates is funding all these vaccines and taking them to Africa. And the main agenda is to like reduce the population, because they say Black people give a lot of birth. You know, there's too many people on the world right now. So, and I kind of like question these people, and I'm like, how much truth is it? You know, when people come in, we don't discriminate who is white, who's Black, you know, it's just like misconception about the whole thing. So I would, you know, just say that people need to do their research and, you know, come up with solutions that are going to be beneficial for them, rather than hearing and spreading rumors about things that are not true.
Thank you, Dr. Gombo. Dr. Ngozi, please.
Okay, so I'm going to talk about the distrust in the Black community in America. I know Dr. Ajibade mentioned something earlier on, and she referenced a book called Medical Apartheid. So there's a lot that you have to look at the history. And a lot of the distrust really stems from the experiences of Black people during the Jim Crow era, during racial segregation in the South. And at that time, Black people could not access care. They were refused care. They could not see doctors. So that is really the history. So when you look at that history, that distrust really stems from a lot of the systematic bias that goes on. Even till today, you see the disparities in healthcare, and you just see the lack of trust. And again, someone mentioned that you don't have a lot of Black people going into medical school. Black men are not going into medical school. You don't have those huge numbers. You hardly, even here where I live in Philadelphia, you can't even find a Black primary care doctor. So and people tend to trust people that look like them for care. You see, so these are some things that have to be addressed in the long run. There are so many other things. We know about the Tuskegee syphilis experiments that was just awful. And there have been so many other instances of medical mismanagement. Not just that, there's distrust also on personal levels. When you have a bad experience in the hospital, or you're not treated well, or you experience racism in the hospital, or your family member experiences this systematic racism in the hospital, you're less prone to be accepting of treatments. So there's so many things that have to be addressed. in the long run. But we're facing a crisis, a healthcare crisis. So we have to sort of look beyond these historical events and say, okay, from a personal perspective, how does this impact, how does this affect me? So, you know, the decision to get vaccinated is a very personal decision. And it's based on risk factors. Like I said to you, a lot of people are going around with diabetes. They don't even know. This COVID pandemic has created a lot of diabetics, people who are home eating chocolates and drinking soda and not exercising. You'll be surprised, so many diabetics this period, just from this 1 year of lockdown. So, and those people who have diabetes, if they get COVID, they don't do as well, unfortunately. So when it comes to the decision, we know about the mistrust, we know about the bias, we know about the disparities. I've gone to conferences where everybody is now openly talking about this. 2 years ago, you could not talk about unconscious bias or systemic racism. Now, every conversation, every conference you go to, everybody is talking about every systemic bias and racism. Every organization has a diversity and inclusion officer. We didn't have this before. So it takes time to change the system. But what are you going to do about it right now? What are you going to do about it in terms of you as a person? What are your own risk factors? It's survival. This is survival mode, you know, and I mean, nobody's going to force anybody to get the vaccine. Knowledge is power. You have to understand that if this vaccine was so terrible, the FDA would not have approved it. And so far as we speak, as of maybe last week when I was preparing my notes from this talk, as of right now, more than 200 million vaccines have been given out. 200 million vaccines. And my own experience is I have not seen vaccine hesitancy. I have not experienced it. In fact, people I offer, do you want it? Yes, they want it. I mean, I've never seen such excitement. So so when people are talking about vaccine hesitancy, I say, I'm not experiencing it personally. I'm seeing people who want the vaccine and they cannot get the vaccine. That's what I'm experiencing. Here in Philadelphia, if you look online, the Black Coalition Group, they gave vaccine. She opened up 24/7 in a stadium, opened 24/7. The line was 8 blocks long. People stood in line in freezing weather waiting for vaccine. So I have not seen vaccine hesitancy, and I can tell you 200 million people cannot be wrong. So it's a question of survival. We know the history, we know about the disparities in healthcare. They are there. It's going to take a lot of time to fix those disparities, but you decide as an individual for yourself what the best thing is for you. So that's my message. I could tell you the vaccines reduce hospitalization. And if a person gets COVID after getting the vaccine, it will not be as serious as somebody who did not. So they will not end up in the hospital. And those that end up in the hospital, once they get on the vent, we all know they don't do as well. So my message is to please get the vaccine. Thank you.
Thank you, Dr. Ngozi. I'm going to tell you something that will shock you, but let's hear from Dr. Ajibade and Dr. Ogoji before I tell you what I need to tell you. Dr. Ajibade.
Thank you, thank you. There's something that's been going on for a few days with my cybersecurity, my antivirus, and my camera. It just turns it off. So I'm definitely still here, but my camera is not coming back on. I don't know why. I'm gonna have to exit and come back in later, but I really don't have much more to add. What I did want to add was, as far as the clinical trial makeup goes, in the Pfizer trial, there were over 37,000 patients. 2% were from South Africa. So, you know, like I said, compared to historical practices in pharmaceuticals, you know, I think that was a decent effort here, more than decent, you know, like I said, it's all relative, right? To be inclusive. So 2% of those Pfizer patients were from South Africa. So not just European Africans or African Americans, there were Africans in there from the, I guess, motherland. I also I think the other thing for me, as I look back, as I look at this whole issue is, have been hesitant, and I had to study my way into becoming more comfortable. I have to be honest. I think that one of the things we have to remind people of is, I had a slide last month, that said, what have vaccines done for us lately? And I think for me, that's very important as we talk to people who are still hesitant or living in denial. Is vaccines were not invented last year by Bill Gates or anyone else or the FDA to respond to the pharmaceutical, to respond to the pandemic. Going back to the 16th century, it was called variolation, V-A-R-I-O-L-A-T-I-O-N. It's been shown historically. There's a medical school in Philadelphia, I forget the name. They have a very nice website with vaccine history and timeline. Going back to the 16th century, the Chinese utilized this approach to protect people. And then, like, what's his name? Lawrence McDonald said, an African introduced this practice in the United States. So, and then I look back, it's like I said, it's all relative. We're all very experiential by nature. I have never questioned I have 3 little children. The oldest is 9 and the youngest is 3. I have never questioned the children's pediatrician when they, offer a vaccine to my children, because not I even studied it extensively, but we all know, that our children should be vaccinated. The schools expect that. They expect our children to contribute to herd immunity, and only a few children are exempted based on their health status. So I think all of this for me, I think we need to even present beyond COVID that vaccines have done a lot. On the World Health Organization website, 2 to 3 million deaths are prevented every year because of vaccines. So I think all of that we need to remind people that it's not a COVID innovation or technology, that it saved life. A few years ago in the state of, in California in the United States, there was an outbreak of measles, a disease that's been well controlled and maybe even we can argue almost eliminated or eradicated in the United States, because a lot of anti-vaccine parents, which the more, I guess, hippie or forward-thinking or progressive the state is, there tend to be even more anti-vaccine people. They're linking it to autism, and there's no evidence so far. The doctor who linked vaccines to autism in children, it's been debunked. They said, I think, it faked data or something like that. So I look at this whole body of evidence for me, even beyond COVID, to say, this is ridiculous. And I'm shocked that even I, a scientist, I'm PhD trained. I actually worked in a tumor vaccine lab for 5 years as a postdoctoral fellow. I fell into that sort of like, again, I think it's the uncertainty. And, for those of us who would just take time to study and then share with other people that vaccines have done a lot for humanity, for civilization. Our children are expected to be vaccinated. The doctors even will warn you that, expect them to experience pain. They may be fuzzy, they may cry for a whole night. Just give them some Tylenol. It's not different from some of the symptoms with the COVID vaccine. So how have we let certain people work us into this frenzy and euphoria and, all this fake stuff? So I think it's just important to remember that. And then as far as diet goes, the question in there, Dr. Ngozi had addressed, and also I think maybe Dr. B, that, the pre-existing conditions that increase the risk of poor outcomes or even death with COVID is consistent, diabetes, high blood pressure, hypertension, cardiovascular diseases, and diet is linked to all this, so the public health, and which is something we failed, I think, in the United States and even maybe in Africa, that we failed the Black community generally, just with this poor access, poor education, that's contributed to a lot of this pre-existing disease being higher in the Black population. And so COVID was just waiting. It was just like a leaf about to fall. That's why I say you have got a dead leaf about to fall, and then you've got the strong wind, a barely strong wind, but in this case, huge, humongous strong wind comes, and it's like all the leaves, it's fall, it's autumn all over again. So it's many things, multifactorial. And I hope that one of the good things that comes out of this crisis is, just like I said, more more Black people going into medicine, into sciences, and then just more funding, to improve overall wellness, wellness in the community, and just overall poor communities, either white or Black, but it's disproportionately affecting minorities. And same thing in Africa. Thanks.
Thank you, Dr. Ajibade. Dr. Ogoji, then I'll weigh in before handing over to Niason, because I need to share some information.
Well, I can see it's almost 10 past our time, so I'll be very brief.
No, actually, we extended. It's a special show today because of what happened last month, so we are doing 2 hours.
Okay, good, okay.
They don't take 2 hours.
Well, the reason for vaccine hesitancy has been discussed at length, and mistrust and all those things. I'll address what's the way forward. What is the way forward? The first is to get our political leaders on board. They should keep their mouth shut if they have nothing to say, and let the healthcare providers talk. Just like in the US, where if you're a Republican, there's no vaccine, there's no COVID. Democrat, COVID is gonna kill you tomorrow. In Nigeria, if you're APC governor, COVID is gonna kill you tomorrow. If you're PDP, there's no COVID. So I don't know why politicians are trying to make this a dichotomy. That's one. Number two, we can take advantage of our spiritual need. Africans and Blacks in general have a very strong faith in God and belief. So if we can get on board with our pastors, our preachers, to talk to our population about vaccine, it will go a long, long way to change things.
Yes.
Because I mean, our preachers have to really, really get involved, because people do whatever they want to say. Tell them to drink their pee, they drink their pee, So getting on board is wonderful, but we have to be careful, because our preachers too are not very trustworthy sometimes. They take advantage of the populations. They want people to come to them for COVID treatment instead of going to the hospital. And then they want people to come to them for all sorts of treatment. Why, if they are sick, they run to America to get medication. So we need to get genuine men of God who will be honest and say, look, I am the spiritual director. I can pray for you, but you need medication. You need vaccine. You need treatment from God. Without God, those medications will not work. Go get your shot. I will pray for you. Works, things like that. That will go a long way to improve the uptake of vaccine among African Americans and Blacks. And most importantly, it's high time we get involved in research. I can guarantee you, if you call 10 Black men, there's a research about COVID vaccine, who want to go? 9.5 will say no, 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 no.
That's true.
It doesn't matter whether they give them $1 million or $50,000. The answer is no, 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 no. Of course, it's boiled down to the mistrust.
Yes.
So my take here is that our politicians should keep their mouth shut if possible. Let the doctors or the medical providers be on the front line. Let's get our pastors, our chiefs, our traditional healers to be reasonable and say, look, we work as a team. We have been doing this for all these years. You can see without the white man medicines, things like polio, measles, tetanus, chickenpox, smallpox will be here, clean us in numbers. In the past, I mean, when I look at the vaccine, what vaccine I've done, I say in the past, people have 10 children because only 2 survive. But now people have 2 children because all the kids, once vaccinated, they won't die of vaccine-preventable diseases. And finally, the question that if you get a shot, will that protect from COVID? No, the shot will not prevent you from getting COVID. It's just that it prevents severe disease, prevents hospitalization. It could, I mean, COVID will come to your body, you're ready to fight it. And the chance of dying from COVID become less and less, just like any other shot. Flu shot, you get the flu, but you won't go to the hospital. You won't develop pneumonia. You won't develop all type of complications of the viruses. Because viruses don't kill you. What kills you is the pneumonia, most commonly, that affects your breathing, or when it affects your heart, your kidney, other parts of the body. The virus itself will not kill you. So the shot will help you fight the virus. So the virus will not overweigh your body system and kill you. Thank you.
Thank you, Dr. Ogoji. I want to acknowledge our sister, Olanika. I will give you the mic later, but I want to comment, Dr. Ngozi, I am so glad that in your practice you've not experienced vaccine hesitancy. I think Ambassador Lisa posted something on the chat box that they are not excited, they are just afraid. That's why they are having it. But I want to say something. If you guys, like I said last month, I have personally not weighed in, on my own beliefs on these vaccines. I'm not against vaccines, but I don't like taking medications, even though I can get anybody to take medications. It's not hypocrisy, and it has nothing to do with my profession. Since I was a child, I don't like taking medications, period. I don't take the flu shots. Up until yesterday, I had not decided on taking this vaccine, but I made up my mind yesterday that I was going to take it, not because of me personally, but to assist with the herd immunity. We have to look out for each other. We have to be each other's keeper. Enough people have taken these vaccines. I have a lot of healthcare professionals in my family, a lot of physicians who are on the front line, a lot of nurse practitioners who have taken the vaccines, and they're all fine. So I made that decision yesterday, just yesterday, that I was going to take the vaccine. I have not decided which one, I was going to take, but I made that decision yesterday. But I just want you to know that there are a lot of people out there like me. Again, it's not specific to this vaccine. I don't do the flu shots. When I have the flu, I take pepper soup, and it resolves in 12 hours. That's been the case. I'm not prescribing it. I'm just telling you my story. You cannot argue with my experience. So I want to plead, to all those out there who are hesitant. Believe me, if this daughter of the soil here can decide to take that vaccine, you should. Because like I say, I don't take medications, period. I don't. So I want to encourage everybody. I don't care what your profession is. We all know what happens in the system. I was actually part of the varicella vaccine studies in our hospital. I was a supervisor at the largest pediatric hospital in the world at the time, and we participated in that study. So I know what it takes to get a vaccine to the market. But thank God, with new technologies, things, yes, this was definitely accelerated. So it also contributed to the vaccine hesitancy. But I'm sure a lot of people have taken those vaccines, those shots by now, in case people were going to be turned into zombies and other things that would have happened already. So I want to plead, encourage everybody, take it, if not for yourself, take it for the community. Ania Song, you can pose a question to Ola, or if she wants to weigh in.
Hello and welcome to the show, Ms. Olanike. We are happy to have you here. Please, we're discussing the vaccines and the mistrust, especially among Africans and Black people. What is your take on that topic? Please weigh in, unmute yourself and come in.
Thank you so much for this opportunity. My name is Olanike. It's a very great conversation going on. And to start with, I'm glad that I will be having my first dose of COVID vaccine tomorrow, which I'm very excited about. My husband has completed his 2 doses. He had little or no side effects. I mean, he experienced little or no side effects, just minor pain and everything. Of course, like the doctor said earlier, when you take vaccines, you should expect to have mild adverse effects or pain or sore of anything. It's a good thing. I don't know if it's been talked about. That's to show that your body system, immune system, is reacting to the vaccine that you get. It's working. That means it's working. You are building immunity against the virus. So I don't have much to say, but I really want to weigh in about our people in Africa and how they perceive this vaccine. Even in the United States, I still have some Nigerians that are telling me every day, oh, Nikki, what do you think about this vaccine? Are you taking it? Are you going to take it? What is the long time side effects, complications? I mean, is there any data yet about long-term efficacy, side effects, and everything for this? I was like, okay, there are still many unknowns about this vaccine, but what we do know now is that it is safe and it can save us from this, and we all need to get on board. And another thing I told them, I'm pro-vaccine for this COVID especially. I've seen people at ICU suffering for this disease. I said it last time. it's something that we need to do whatever we can to make sure that we protect ourselves, our community. You may be okay when you get the COVID, disease, but how about the people around you? We need to think about that. And I'm glad I'm part of this, the volunteering team. I mean, I have opportunity to volunteer in my local county here in the United States for the efforts towards the mass vaccination. So I help them to vaccinate people in the community. And I've seen a lot of people receiving this. They have doubts. Everybody still have doubts about it. But as of today, the data still tells us that this is the right way to go. If we can all do this, come on board, educate people in Africa. We are here, we are getting it, we are okay. We are hoping this will save the world. This is the only option we have for now to save the world. People are still dying from this disease. We just need to go back home. Like the doctor said the last time, our pastors, yeah, they need their faith, their science. But faith and science right now, I believe, to me, to the best of my understanding, are going side by side right now. And they are going to the right direction because wisdom is profitable to direct. That's what the scriptures say.
Okay. Go ahead.
In conclusion, I just wanted to say we need to go back home, make sure we have at least some people, either online conversation, or we organize seminars, invite all these clergymen, our politicians. We can do it even in this group. We can just reach out to some stakeholders, doctors. Let's educate people based on statistics, based on clinical trials, based on the results. If we get people at the top that are influential, they will be able to pass the information to the people under them, like the doctor said all the time, the church members, wherever the organization are. If the information comes from above, that's what I think about Africa. People seem to believe our leaders. I mean, when I mean leaders, I mean the pastors, the head of organizations, the politicians. So I think if we can organize a seminar like this, intentionally pick out some people that we know that they are influential, even if it is pastors, we can do it. I'm just suggesting to the house, I don't know. I just think we could do this virtually, online, educate people, get the information out there, and you never know how that will be. We go. Thank you so much.
Thank you so much, and welcome to the show again. Please always tune in on Sundays and participate. We're going to take a quick round of the table. I'm going to assign, please be limited to your time. Eric, you have just 30 seconds. If you have just a question, that would be very great. If you have a quick remark, 30 seconds, please. Time is beginning to be against us. So go ahead, Eric.
Yeah, I will just go with what Dr. Kingsley said about the church and the community with the leaders. The church need to stand up and accept science is there, and they need to sensitize the population. The miraculous way is there, and the science has to play a part as well as the church leaders have to play a part. They should not push the population away from science. They should encourage the population. Thank you.
Thank you very much. Reverend Solange, I believe you have a last word to say as we leave the show soon.
Oh, this has been very informative as always. Dr. Kingsley, oh God, you mentioned about pastors, and Dr. Eric was saying the same thing, but there's some challenge here. Most of the pastors and spiritual leaders, this is one of the things Reverend Pam and the other doctor was talking about, false information, conspiracy theories and all that. They tell their members that if you take the vaccine, it's a mark of the beast, as in the book of Revelation 6:6, that do not take the vaccines. So I don't think the pastors are encouraging their members to actually go and take this vaccine. And we know most of the members, the word of the pastor is gospel. If you tell your members, if you take the vaccine, it's 66, you end up in hell, how do you think they're going to take it? So that's another area of challenge when it comes to encouraging members of certain congregation or group to take the vaccine.
Thank you very much. Dr. Gumbo, please, you have the right now to say your last word.
Mine is more of a question. Do you think that the mRNA vaccine can change your or alter your DNA?
That's the conspiracy theory.
No.
All right, are you done with that?
Okay.
I
Is that all?
recently listened, if I can just add, I apologize, a presentation. I was attending a conference this past week. The work on the mRNA vaccine started 30 years ago in Wisconsin by scientists out there who was experiencing. So mRNA is very unstable. And that posed a lot of challenges for this a female scientist, couldn't get funding. And but they had actually tried to deploy it several times. The NIH, I listened on Friday to Friday, scientists from the NIH, NIAID, National Institute of Allergy, Asthma and Allergy Research or something, NIAID. They'd been working on this for several years. She said 2003. They just had challenges because of the instability of mRNA, which is why this Pfizer and Moderna vaccines are in nanoparticles. So these are lipids. So these are part of the contents. And I've actually looked up all the contents of the vaccines. It's salt, lipids, sugars, stabilizers in there. So they've had so many challenges getting this vaccines. They try to use it for Ebola. But then, because of the scale of the crisis last year, and the amount of funding that came in from not just the United States government, worldwide, I think that also facilitated. So there have been a lot of preparation behind the scenes, but we never knew about it because, none of us ever faced COVID before. I think it's new and hopefully the last time we all see this in our lifetime, but, just a little bit of perspective there. It's outside the nucleus. It does not go into, it doesn't go into where the DNA is. So it's very unstable. It'll coat protein, which is a spike protein, and then it's degraded.
Thank you very much, Dr. Ajibade. Thank you all for being here today. Our anthem is queued up there for play. We're towards the end of the program. I think we're concluding the program. I just want to personally thank all of you for all the time taken. Please, whenever you have an idea, just shoot it to Africa Online Media Corporation and we'll be able to include it in our discussions. We need topics from the public. We need topics from professionals like you. Please help us keep the show going. Thank you all so much. And Africa for Africans or Africans for Africa, that is the anthem written by our chairperson and played by, what is that again? Okay. DJ Skipper. So please.
Okay, Niason, just a minute. Dr. Ngozi, did you give your last word? I don't know if you gave your last word or not.
No, I didn't. Thank you so much for inviting me. I think my message is that as much as people can, if you're invited for the vaccine, try to accept it. This is very essential, both in America, in Africa, globally, because for the world to go back to normal, we all have to have this herd immunity, and this is not going to happen unless we embrace the vaccine. So far, about 200 million people have gotten the vaccine, and Africa has a population of about, say, at the last census, 1.6 billion, probably more. And right now, between COVAX, the African Union, and the African CDC, millions of vaccines are going to be delivered to Africa. It's very important because the sooner we get vaccinated, the sooner the borders open and usual activities resume, education and trade. And this is very essential to survival. Otherwise, Africa is going to regress. If Africa does not accept this vaccine, they will continue to regress. Already there are huge gaps in economic situations and care. And it's very essential to embrace this vaccine, get the vaccine so that we can open for business as usual. Thank you.
Thank you, Dr. Ngozi. On behalf of Africa Online Media Corporation, I want to thank everybody again. You guys see how great this show was. The devil had to send some demons to try to interrupt, but we kicked them out. I just want to say, Niason, please, Dr. Ajibade, Reverend Solange, Ambassador Lisa, remind me going forward to make sure that I don't enable participants to unmute themselves. From now on, we'll make sure only people that we want to unmute will be unmuted. So thank you, everybody, and wishing you a fantastic match. Enjoy our anthem and just God bless you.
Thank you all, and bye.
Oh, Africa. Oh, no. Africans, Africans for Africa. 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 Africans have many bright ideas. If only you let us share. If you really want to know my history, please come, sit down, listen to my story. God gave us a wisdom. He guides our footsteps, makes us shine and transform. Hey, as one people, with so many cultures, yet indeed we are one. Stand up, Africans, let's save Africa. Let us all unite behind Africa Online Media Corporation. Stand up, Africans, let's save Africa. It's time to come together, promote awareness, progress, and solution. Hey, Africans, Africans for Africa. Africans, Africans for Africa. Africans, Africans for Africa. All Africans can rally for a common cause, to believe without judgment in what our brother does. To identify and resolve our challenges, to allow each other's ideas without regard to standards, as one people with so many cultures. Yes, indeed, we are one. Stand up, Africans, for Africa. Let us solve all the problems plaguing our continent. Stand up, Africans, let's save Africa. Let us empower Africans in and out of Africa. Stand up, Africans, for Africa. Africa Online Media Corporation, that's a good way to start. Stand up, Africans, let's save Africa. They have all the resources we need to benefit our society. Oh. Education for everyone, if we believe. Prosperity for Africans, if we believe. Medical facilitation for Africans, if we believe. Stand up, Africa, yes, for Africa. Africa Online Media Corporation, that's a good way to start. Stand up, Africans, let's save Africa. Africa is the cradle of civilization, the motherland. Stand up, Africans, for Africa. We were enslaved not because we were weak, but because of our hospitality. Stand up, Africans, let's save Africa. Jump on the Africa Online Miracle Jet. Don't be left behind. Stand up, Africans, for Africa. Together we shall succeed. Together we will win. Stand up, Africans, let's save Africa. We are writing our own story, the truth, and we shall tell it to the world. Stand up, Africans, for Africa. No more lies. Africans own Africa.
No more lies. Africans own Africa, and we will not be intimidated. The devil is not part of this organization. Thank you so much. The hackers hacked the wrong or attempted to hack the wrong show. Thank you all, and God bless you.